Women's full participation in driving conversations on matters of public health in Africa was one of the central issues which occupied the minds of participants at the Second International Conference on Public Health in Africa. The event, hosted by the Africa Center for Disease Control and Prevention and the African Union in partnership with the government of Rwanda, comes to a close on Friday in Kigali. The conference serves as a catalyst to build more resilient health systems that allow African countries to better prepare and manage emerging health threats while also addressing long-standing infectious diseases. The theme for the conference is Preparedness for Future Pandemics and Post-Pandemic Recovery, Africa at Crossroads. Some participants took time out to speak to the news agency of Nigeria.
The key message is that we cannot have universal health coverage without women. We cannot have the advancements in the health of the continent we want without women. And we cannot have economic development without women shaping the health agenda. So, and the take-home message for me is that we need to remember that women are not a single homogeneous group. They're diverse in terms of age, ability, physical ability, experience, areas of work, and that diversity, that richness is relevant and important for us to achieve the health goals that are encompassed within the Africa Union's Agenda 2063 about the Africa we want.
I think the conference has highlighted or has made good progress in terms of even having a plenary session that focuses on women in health. That is one step in the right direction, but we still need to do more because women need to have a good environment in which to perform at their best capabilities, considering all the other responsibilities that they have.
I'd say that women are already active, both as providers, but also as participants. I refuse to use the term beneficiary because they are full participants across the spectrum of, I would say, of healthcare. We can be more present as women. So the role of women is already here. Whether it's advocacy, whether it's management, whether it's research, whether it's care, and any of these aspects, the gender lens, of course, is quite important.
I think that question about how much can be achieved without women's full participation is a critical one that speaks to how do we ensure that women have a voice, right, in the decisions that are being made, because health, you can't talk about health and taking out women.
As much as women, we have to be intentional in our approach. You have to occupy these places, more of these places. There is a key role of our colleagues, our male colleagues, as we shape these policy spaces, as we shape these facilities, as we deliver the care, as we work on research, as we build the next big healthcare system.
CPHIA 2022 is the voice of public health on the continent. It is the convening of all the expertise on the continent to discuss public health issues that are for Africa, by Africans, with solutions that will be implemented for Africa. Where else would we be? This is the place to be.